Hi everybody, my name is Swati Maan. I am a dentist. We all know about chewing gums. Well, people have been using gums for centuries. Some like it as a mouth freshener, some like the taste of it, and some like it just like that. Today I'm going to talk about the real benefits of chewing gum on our oral health and on our teeth. So let's talk about it. So what is the first thing that we notice as soon as we start having a chewing gum? We see a gush of liquid. We feel a gush of liquid inside the mouth, which is actually our own saliva. So that is really the main action or the main benefit of chewing the gum. It makes our salivary glands really stimulated, and we see a lot of saliva coming inside the mouth. So saliva, we all know, is extremely important. First of all, saliva being a lubricant prevents dry mouth. So for anybody having dry mouth, saliva is a really important component. Number two, saliva has lots of minerals in there. So if our mouth is very susceptible to cavities, and if we see we are having sensitivity because of the drinks or foods that we have, saliva really helps in remineralizing of our natural enamel. Number three, saliva is a natural antibody or a natural antiseptic. So anybody having a soft tissue problem, so any disease on the soft tissue, saliva really helps in quick healing. Number four, it has a rinsing action because after all, it's a liquid. So with the rinsing action, it rinses off the stains from the food particles that we are having. Number five, saliva neutralizes the pH balance, which means to say that whenever we eat or drink something, the pH level of the mouth really drops down, which is really responsible for the decay or the cavities or sensitivity inside the mouth or on the teeth. By having chewing gum and by salivating, we are neutralizing that pH level and bringing it back up to an alkaline level, which is the right environment for our mouth, which also beneficial in killing the bad bacteria and also prevents our mouth from the decay. So yeah, it's a big deal. All the components are quite helpful for us. So now the question comes, which chewing gum shall we go for, or which chewing gum is the best? The first thing, it should be sugar-free because we all know sugar is responsible for all the chaos that we get inside the mouth, whether that's cavity, gum disease, and various other problems on our teeth. So sugar-free chewing gum, ideally having the xylitol as a sugar substitute. You might have seen one of my videos where I've specified how xylitol really helps in killing the bad bacteria. So it will be really beneficial if you go for chewing gum with xylitol as a sugar substitute. Number two, recaldent, which helps in slowly remineralizing our natural enamel. So the patients having sensitive teeth, or if they have a lot of erosion, or if they have a lot of acidic drinks in the form of fresh fruit juices or things like wine, etc., in those cases, the chewing gum with recaldent is really beneficial. But if you are allergic to milk or if you have milk intolerance, then this is not a great component, recaldent, to remember. Number three, if the chewing gum is ADA approved, which means it's been tested for its safety and efficiency, and it's sugar-free as well. So now you know what to look for. And of course, you can go for your chewing gum from there. Definitely not for a sugar one, sugar-free. If you're suffering from any TMJ disorders, that means if you have any jaw muscle problems, any jaw joint problem, if you have clicking or grating noises in your joint, if you have a grinding or clenching habit, then of course chewing gum is not really the best tool for you because that stresses out the facial muscles. There was a recent research done where many people have raised concerns about the level of mercury inside the mouth if they have a silver filling and the chewing gum. Well, that is true that if you have chewing gum 2 to 3 times in a day, you release the vapors of mercury from your silver filling. But the researchers have proved as well that the amount of vapors of mercury that's been released, they are much below the danger level. So I wouldn't say that for this thing we have to worry. So overall, the effects of the chewing gum on our oral health is great. I give a thumbs up to that. So go for it. If you like it, yeah, just continue having it, making sure that you know which one you're buying. So thank you again for watching. If you like the information, please subscribe to my channel. Please like the video and I will see you on my next video. Take care. Bye-bye.